And you offered really good ideas in terms of how we can start to overcome it. And but then you hit on, how different depression and how different, perhaps different forms of anxiety, how those may need to be treated. And so I don't want it to be left undiscussed, I guess, that we need to discuss just resources. Just this is sort of a PSA, if you will, resources for people who are perhaps dealing with some more, even deeper traumatic, issues.
Sure. I mean, the first thing is to say that like everybody needs help sometimes, and sometimes you need a lot of help. And some of those dark times are when you don't want to reach out to anybody. And I've absolutely had close friends who told me months later, I had a friend who told me sort of like several months after the fact, she's like, oh, by the way, I had a divorce. I was like, you didn't tell anybody. But it totally happens. And I totally understand like that would happen. Like I could picture that happening. And so I think it can be hard in those times to, the best thing would be to reach out to the people who you know and who love you, to like make sure your like core support system is there for you. Sometimes there are things that are really hard to say to people who are in your actual life. And so reaching out for help, there is, the National Suicide Prevention Hotline is very active and has been very active since March, when things kind of like went haywire. And they're there. They're human beings who are there, and they're just sitting and waiting to help somebody. And so you're kind of helping them by letting them help you. Reach out to your doctor. Hopefully you have one, your primary care doctor. People have a misconception that during COVID, the doctors are all super busy. There's a lot of doctors out there who are not super busy at all, because people aren't coming, and they're like ready and they have time to be on the phone, and you don't have to go in person if you don't want to. Like a lot of us are doing telehealth. You just get on the phone, you get on a Zoom, and you can and they can help connect you with resources. I was about to say there's no shame in being depressed. I know there is a lot of shame that people feel, but like broadly, like it is something that happens to people. It's not your fault, and the thing that is within your control is reaching out for help and accepting help when it's given. I think a lot of people, might feel like, okay, like I'm being badgered by like my family or people who love me to like go and see a doctor or like go and get like treated for depression or anxiety. But I'm tough. I'm gonna like sort of like, I'm not gonna do it. Accept the help. Go for that one visit. You might find that therapy isn't so scary. It's just another person who isn't gonna talk to your brother or your best friend and isn't going to gossip about anything. Like they're gonna have it confidential and just like talk to you. It can be super, super helpful. And those resources are out there.
And you mentioned the National Suicide Prevention Hotline and the other resources. And I want people to add to that, it's not necessarily for people if you feel like you're on the edge of suicide. They also are dealing with, as you mentioned, emotional distress, and someone to talk to may perhaps a first step. And that number, I just thought I'd like to throw that out there. It's 1-800-273-8255. That's the National Suicide Prevention Hotline, 800-273-8255. So thank you so much for addressing that, Dr. Chen.